Dr. Brooke here. I'm a board-certified psychiatrist who never says behavioral health, and here's why. I cringe at this phrase. I mean, I even work in a department that uses the phrase behavioral health. It's the behavioral health department of one of the clinics I work at. And it just rubs me the wrong way because the department or the provider or the letterhead all saying behavioral health implies that I am there to assess for and treat your behavior, that there's something wrong with the way you're behaving, and that's what we're here to fix. A heart doctor treats your heart, a GI doc treats your gut, and if I'm the behavioral health specialist as the psychiatrist that went to medical school and specialized in psychiatry, then I guess I treat your behavior. And that sounds like punitive in a way. That sounds like you did something wrong and I'm here to correct it, when I'm really here to treat your symptoms, to treat conditions that have, strict diagnoses and have treatment algorithms and have evidence-based treatments. It's not supposed to be corrective or punitive. And I think behavioral health kind of implies that. On a similar note, I also don't love mental health, even though I say it a lot and I use that word a lot in practice and on social media. A lot of people use the word mental health. My patients often use it. I think that that's a word that makes psychiatry and also psychology and other, specialties in this area. It makes getting that healthcare more approachable and accessible. And I think it does normalize it to an extent. But it also, I think, belittles it as a specialty to an extent as well, because nobody says, oh, I'm a heart health doc when they're a cardiologist. Nobody asks, oh, how did your gut health appointment go today when they go to the gastroenterologist? For some reason, though, psychiatry has gotten this rebranding of mental health care. And yes, it is that, but it's the only specialty that has really gotten that. So I do use that word a lot. I use it in my posts, in my conversations with patients. I really never say behavioral health. I do say mental health a lot. I think behavioral health is kind of more problematic, and it concerns me when I see that. Mental health has, I would say, more pros and also some cons. There are reasons to be saying mental health versus psychiatry, but I'm not really a huge fan of either of them. I would like to just say that I'm a psychiatry provider. That has its limitations too, because I think there is an assumption that psychiatry is just medication management and not diagnostic assessments, that I can't incorporate other therapeutic modalities, that I can't talk about nutrition. So all of these are imperfect terms, but behavioral health is probably the most imperfect, the baddest one among them. And so I don't say it. I don't think you should either.